am Dr. Bhushan and I'll be presenting on role of PET-CT in determining disease activity in patients of spinal tuberculosis. Let us consider these two scenarios. Patient A is a 40-year-old female, case of L4, L5 cough, who received 12 months of antitubercular therapy, stopped after symptomatic and hematoradiological improvement. Case 2 is a 37-year-old female, case of D6 to D9 coughs, who also received 12 months of antitubercular therapy and it was stopped after symptomatic and hematoradiological improvement. We then went ahead and did a functional scan for both of these patients. In patient A, there was no residual activity at the end of 12 months, while in patient B, there was residual activity at the end of 12 months. This raises a doubt about the duration of antitubercular therapy to be prescribed in patients of spinal tuberculosis. Also, the literature is variable and there is no standard duration when the antitubercular therapy should be stopped. So in this view, we conducted an observational study with the aim to understand the disease activity with functional imaging, that is PET scan, following institution of antitubercular therapy in spinal tuberculosis. We also did analyze and compare disease activity with SUV max in multi-drug resistant tuberculosis with the drug-sensitive tuberculosis. We studied 50 patients after approval from the Institutional Ethics Committee. We did radiological evaluation with PET scan at 6 months interval after the starting antitubercular therapy. We also did X-ray and MRI for the similar patient at regular intervals. So we studied SUV max as a parameter to study the disease activity. The antitubercular therapy was stopped when the SUV max turned 0. Since there was variable involvement of the vertebra, we did a SUV max per vertebral body to maintain the uniformity. So the results, the mean age was 32.41 years, 44% of the population was male and 56% was female. The mean antitubercular therapy duration was 17 months for the drug-sensitive population, while it was 28 months for the drug-resistant population. We divided the study population into groups depending on the duration of antitubercular therapy as 0 to 6 months, 6 to 12 months, 12 to 18 months, and more than 18 months. And then we studied the trend of the SUV max in this patient. And it was found statistically significant that the decrease in the SUV max was found to be statistically significant. We also did study the SUV max in drug resistance versus the drug sensitive population, and the SUV max in the drug sensitive population was always on the lower side as compared to the drug resistant population, the corresponding group. We also did compare surgically treated patients with conservatively managed ones, and the SUV max in the surgically treated patients was on the lower side, which mostly is due to reduced disease bulk as a result of the surgery. So towards the discussion, there is considerable variability with respect to the antitubercular therapy duration in the literature. However, disease recurrence due to inadequate treatment and drug resistance due to excessive treatment is a common problem faced by the surgeons. Due to clinical radiological delay in spinal tuberculosis and difficulty in assessing the disease activity clinically leads to erroneous results in the duration of antitubercular therapy. We observed variable healing with the SUV max returning to 0 at an average of 15 months in the sensitive population and 22 months in the resistant population. So FDG PET-CT is a functional and objective imaging for evaluating the disease progression and healed status in spinal tuberculosis, and thus antitubercular therapy should be tailor-made and not administered as a fixed dose duration. I would conclude by saying, as one size does not fit all, similarly, fixed duration of antitubercular therapy should not be made a norm. Thank you.